Nurse Barb. I'm a women's health nurse practitioner, and this is your daily dose on pregnancy and the first trimester. If you've just found out you're pregnant, chances are you have a lot of mixed emotions. You may be feeling elated and full of joy, or maybe some ambivalence and confusion, especially if you're starting to have some symptoms of nausea, tender breasts, headaches, difficulty sleeping, nausea and vomiting. Or you may be feeling unsure about whether or not this is right for you. These feelings are natural, they're normal. Most women feel a little bit ambivalent when they become pregnant because, after all, your life is going to change. I say to my patients, that's why you get 9 months to get used to this idea. And those early pregnancy symptoms, they don't help either. Maybe you've had a lot of pressure from family members or friends to become pregnant, or you have your own expectations about getting pregnant at a certain point in your life. And that can layer on a lot of expectations for how you're supposed to feel. After all, in this day and age, there's a lot of compare and despair, and people have a lot of announcements on social media about being pregnant. Well, you may not feel like doing that, and that's okay. So be as kind to yourself as you are to everyone else, and give yourself a chance and some time to really take on this new role in your life and to be more comfortable with it. And of course, you can always talk to your prenatal provider about any feelings you might be having, because we've heard all of it for many, many years, and there's no judgment. Now, in the first trimester, most women also want to know, well, how far along am I? And if you saw my 2-minute video on ultrasounds, you know that it's really important for us to find out how far along you are and what your due date is. Now, when people think about pregnancy, we often say it's 9 months. Well, not really. It's 40 menstrual weeks, and we start counting from the very first day of the last menstrual period. And then it's 40 weeks after that to the estimated date of delivery. So when a woman becomes pregnant, we know she didn't get pregnant on the first day of her last period. Typically, ovulation is about 2 weeks later. And this is a worldwide standard for how we date a pregnancy or figure out how many weeks along you are. So even if you had IVF and you know exactly the day you conceived your baby, we count the first 2 weeks prior to conception. Those are counted as menstrual weeks. So when you come in for your first OB appointment, maybe you're 4 weeks late for your period, and we do an ultrasound, and we might find that, well, it's an agreement. You're 4 weeks past the expected period, and so we say you're 8 weeks pregnant. Now, I know that's really confusing, but again, this is a worldwide standard for how we date a pregnancy. And when you're doing an ultrasound, it's also correlated with those menstrual weeks. So when you come in and you're 10 weeks pregnant, we know you've only really been pregnant for 8 weeks, but we count the baby as 10 weeks along, and then we can measure progress. So why is that important? Well, for one thing, we want to know your due date. And then it's important because if you go into labor early, is that preterm labor or is it right on time? And we want to make sure that a woman's not going post her due date, because there's also a lot of risks at that point. So dating a pregnancy is super important. And when women come in for their ultrasounds, we're always measuring the baby's growth. We measure their biparietal diameter, or their head. We measure their abdomen, and we measure the length of their legs. And then we correlate that with what we know for measurements that are for average babies and average growth. And that's also important, because if a mom isn't growing enough, we need to know, is that baby's growth correlating with where she should be in her pregnancy, or is the baby getting too big? Both of those things can involve risk. And when we figure that out, then we know, well, we probably need to do further testing, maybe see that mom more often, do more ultrasounds, because then we're looking at the amount of fluid that surrounds the baby. We're measuring, again, the baby's growth and looking at all of the anatomy. So in the first trimester, there's so many questions, and the number one thing most moms want to know is, what do I need to avoid? That's an important point because early in pregnancy, baby's growth and development is really, really rapid, and all of their organ systems are growing and developing. And so we don't want to expose babies to anything that could possibly interfere with that. But if you're following a really healthy diet and you're not smoking, using any street drugs, and you're not having any alcohol, then those things, of course, are the most worrisome, but babies should be fine. But there's a couple other things you may want to avoid. So let's get to them. So when you're pregnant, you should avoid having any of the over-the-counter pain relievers that contain ibuprofen in them or naproxen sodium. And the trade names for those are Aleve, Advil, Motrin. And that's because those pain medications can interfere with the way a baby's blood clots, and of course the way your blood clots. So Tylenol is considered safe in pregnancy. It's also important for you to avoid coming into contact with raw or undercooked beef or pork. And that's because there can be parasites or other substances in that undercooked meat that can cause problems. In addition, moms should avoid coming into close contact with cat litter. Even if a cat is an indoor cat, cat litter can contain toxoplasmosis, and toxoplasmosis can cause an infection during pregnancy, and that can harm the baby. Well, what about cheese? Well, this is a good question. If you're buying cheese that's made from pasteurized milk and it's a hard cheese, it should be just fine. But soft cheeses that are made from unpasteurized milk, those are things that you should avoid. So you should read the labels, and if it says pasteurized, you should be just fine. What about raw fish? Well, sashimi is delicious. Fish is really good food for you, but unfortunately, raw fish can also contain parasites that are too small for you to see, and that can cause problems for you during your pregnancy. What about cooked fish? Well, unfortunately, a lot of fish is contaminated, and so it's recommended that you limit yourself to 2 servings of fish per week. And that includes crab, shrimp, and other shellfish. As long as it's cooked, it should be just fine. When it comes to herbs, any herbs that you use that you normally have in for cooking, like parsley or dill or basil, or anything that you can find in your local grocery store that's in a jar and it's labeled, those herbs for cooking are just fine. But you want to avoid any herbs that are sold in bulk that you're not quite sure about, because some of those herbs can cause miscarriage or bleeding. And so if you have any questions, of course, you can go to my blog, nursebarb.com, or check with your own healthcare provider. So one thing that a lot of moms ask me about is caffeine. Well, the good news is that you can have 2 servings of coffee every day, but you don't want to exceed 5 servings a day because that has been linked to a risk of miscarriage. When it comes to pregnancy, there's so much information and there's so many myths and misconceptions out there. So when you're looking for information, go to trusted sources and always go to your own healthcare provider, because they know you and your baby more specifically and they can give you more tailored advice. I hope this video has been helpful, and if you like it, please click like and please subscribe for more. And again, you can always go to nursebarb.com for more information. Take care and be well.